All right. Hi, everyone. Thank you for joining us today. Things have been a little bit different today than they were last week. Originally, we are scheduled at 2:30, but the state health officer, Dr. Scott Harris, was providing some important updates at 2:30. So thank you for sticking with us or coming back to get the local update here. I'm Rendi Murphree, epidemiologist and director of disease surveillance and environmental services at the Mobile County Health Department. And we're a little bit different this week, I think, just to comply with the recommendations of practicing social distancing and reducing movement about our community. We do not have any of our local stations live in the building with us today, but we hope that they will be picking this information up and sharing it with their viewers. So I'll just restate some of the information that Dr. Harris mentioned during his press update about the number of cases around the state. So interestingly, United States is up to over 35,000 cases with nearly 500 deaths. In Alabama this morning, the update was 167 cases statewide. Those are spread among 21 counties, but Jefferson County is reporting nearly half of those 167 cases. In Mobile County, we have 2 confirmed positives reported. One came to us after our Friday afternoon update. We learned about an adult in Mobile County who was diagnosed with COVID-19 disease late Friday afternoon, and we did not hear about any other positives over the weekend. So Dr. Harris thankfully gave a little bit more information about what the demographics of our 167 cases around the state look like. So they are between 2 and 97 years old. The median age is 44. 53% are male, and from 6 to 7% have been hospitalized. So we've been getting some questions about, do we know how many people have been hospitalized with COVID-19 disease? Still, we know that there's, these numbers may be affected by limits on testing in some areas. So we expect that these data may get to be refined as we see more and more testing come available. Another piece of information that the state health department began reporting on are the number of total tests that have been conducted. And I think we've talked before that by emergency order, positive COVID tests are reportable to the state within 4 hours. We are certain that we're hearing about those in a timely manner. But I didn't realize until today that negative tests are also under the emergency order supposed to be reported to the state health department, but that's untraditional than most reportable diseases, and I think laboratories and hospitals are may not be coming on board with that as quickly as we would like. So while the state says that they, between the state lab and private labs, they know about 1,832 tests that have been performed statewide, we expect that that's probably an underestimation because we suspect that hospitals and labs, not all of them are reporting negative tests to us, but it's really cool that they started reporting that number on their website because I've not been able to provide that kind of information before, but now we can. So let's see, so where to get testing? So the good news is that through the Alabama Hospital Association and the Alabama Department of Public Health working together, today 17 sites open statewide. There are some requirements, of course, but they hope to have 25 total open by the end of the week. And there are 2 locations in Mobile County. I can give you a little bit of information on there, but you can always call the 1-800 number that ADPH has set up if you want to know where to get tested in our county. That number is 888-264-2256. Again, 888-264-2256. I think they ask for your zip code and then they can direct you to the closest site near you. They are not publishing a list of the sites that are out there because some of them, may pack up and move to another location in a different part of town, in the middle of the week. So the best thing to do is to contact that 888 number. We do know that today Mobile Infirmary began offering drive-through COVID testing by appointment only. So you have to call the Mobile Infirmary COVID-19 testing hotline to speak with a nurse and get approval or an appointment to come in for testing. And that telephone number with Mobile Infirmary is 251-341-2819. Again, 341-2819 if you want to call Mobile Infirmary to see if you can get testing there. Just to remind you, everyone is still testing symptomatic patients only. We've sort of relaxed some of that exposure criteria, but we're not recommended testing for people who do not have symptoms of similar to coronavirus, fever, shortness of breath, and cough. The other, another area, location for testing today is the Greater Mobile Urgent Care on Schillinger Road. So this is the Greater Mobile Urgent Care. They're offering drive-through COVID testing, again, by appointment only. You have to call 251-633-0123 and hit pound on your phone, give your insurance information, talk with a doctor about your symptoms, and then if they agree that you need to be tested, they'll schedule you a testing time. Again, that's Greater Mobile Urgent Care on Schillinger Road. Call 251-633-0123 and press pound on your phone. So a little bit more, I just want to remind folks that, everyone is working as hard as they can to expand testing in Mobile County and across the state. Again, the medical items, the swabs, and the transport vessels and media that are needed to transport those swabs are in short supply, and the ones that are available nationally are being directed to parts of the U.S. with the greatest medical need. So we are starting to see more testing being conducted, but we still are experiencing shortages. But our Mobile County Emergency Management Agency and Mobile County Health Department partners out there are working through the state EMA and the federal EMA to try to make requests, and the state is working hard to try to get access to more of those swabs that are needed to take the test for coronavirus. So let me just look here. I've got a whole big old pile of things that I might need to share with you. Just trying to make sure I don't forget something. I just wanted to reiterate that 80 to 85% of people who get COVID-19 will have a mild illness and will recover and will have some level of immunity. So we're really thankful that for most of the population it will be a mild illness. And you keep hearing me say, and the state say, and CDC will say, expect that most people over the next year or two will be exposed and probably infected with this new virus because we're all immune. So we're lucky that it's a mild illness. But the 15 to 20% of the population that will experience complications and potentially death are the folks that are in that oldest age category. So really, we're just be on the safe side if you're 60, 65 and older, particularly if you're over 85. And if you have any underlying medical conditions like cancer or heart disease or stroke, diabetes, if you are obese, did I say cancer already? Cancer, chronic pulmonary conditions, those sorts of things. So please, if you are in these high-risk groups, please adhere strictly to the public health recommendations to stay at home, practice social distancing, and that means 6 feet distance from the nearest person. Again, gatherings of 25 or more are not allowed in the state health order, and this applies to events at your house or with your family. So try to again, the point is to try to keep the crowd size small enough so that you can create that 6 foot distance between one another. So, and also again, practicing your hand hygiene, cough etiquette, sanitizing surfaces, disinfecting surfaces, and staying at home, particularly if you are sick or if you've been around someone who is sick. So a couple of bullet points from, again, we have, the health department has a couple of representatives out at the County Emergency Management Agency, and Erin passed along a couple of points for me to read. So They are still receiving calls from healthcare and long-term care facilities around the county regarding personal protective equipment and testing. And so again, there is an official way to request personal protective equipment and the materials needed for specimen collection, and that goes through our emergency management agency. Also, they're working to confirm testing sites in the state and in the local areas. They have a daily call with the Public Health and Mobile Healthcare Emergency Response Coalition. This is the healthcare coalition that we talked about, where a lot of partners who touch different areas of the healthcare sector in Mobile County had already been working together for many years, preparing for a pandemic event like this. So we're very lucky that that we have their involvement and support. I think they have daily calls to try to check in on what's going on. And then there are some discussions early on, some early discussions about planning for alternate care sites. Should we end up running out of beds at local hospitals. So that is something that's also going on nationwide, because if as the outbreak continues to grow across the United States, we're implementing these community mitigation measures to try to flatten the curve, right? So that we don't have a big spike in cases that would quickly overwhelm our hospital capacity. Instead, if we can slow down and slow the spread of the virus, then we can keep from overwhelming our hospitals and have less severe complications and death. And so this is part of the overall strategy, but we still must plan for the possibility that our local healthcare system and our hospital system could be overwhelmed with people needing higher levels of care in the hospital setting. So let me just switch to another couple of pieces of paper here, and then I will answer some questions. Oh, so one thing I did want to mention is on late Friday afternoon, the state health officer, lots of folks had already left for the day, so you might have picked up on this information, but our state health officer Claire and the governor clarified the recommendations for childcare and daycare facilities, basically stating that the rule of 12 and over, so initially it was that any child or daycare could have no more than 12 children. And what they did to come back and clarify is that if you have a daycare or child care facility that has set multiple rooms in it with closed doors, that you could have 11 children and a teacher or an aide in one confined space, and then 11 children and a teacher or an aide or caregiver in a separate closed space. You just have to be very careful that they're not commingled. So you can't just let them all into the playroom at the same time, or let them all into the dining hall to eat at the same time. So that's a little bit of a subtlety that they clarified. There are some other things that I'll just sort of mention here. And some of this may be a repeat, but all non-work related gatherings of 25 or more, or any size that can't maintain the 6-foot distance between people, are prohibited. So it's not just the 25 people, but if you cannot maintain that 6 feet distance, then it's prohibited. It says employers are to take all reasonable steps to meet these standards for employees and customers. Again, we want places to stay open. We need food establishments to stay open for those delivery and takeout orders. We need businesses to stay open because people need supplies, particularly if you're a drugstore or a grocery store or a hardware store, those kinds of things. But all businesses, as long as they implement these distance restrictions, then of course you're allowed to stay open. Regular programs at senior citizens centers are ended, except that the centers and their partners are urged to assure that clients continue to receive needed meals by curbside pickup or delivery. I think I'd mentioned that before, but I want to reiterate that because the last thing we need to do is to put our seniors in a situation of not being able to get the nourishment that they need. Let's see, facilities providing daycare, I already talked about that one. So long as 12 or more children are not allowed in a room or other enclosed or separate space at the time. And then in-person instruction and classes at all schools and colleges are prohibited. So again, that's at all schools and colleges prohibited, any in-person instruction. There was a clarification that local boards of education may provide daytime special activity programs for some children aged 6 through 12. They may be held for children of essential employees of the following employers. So if you have children and you want to have some daytime activities for children that are aged 6 through 12, you can do it if they are children of these employers: state and local government, first responders, including EMS and fire, law enforcement, hospitals, nursing home, long-term care facilities, including assisted living and specialty care assisted living, end-stage renal disease treatment centers, pharmacies, and grocery stores. I've got taken questions every once in a while about blood donation centers, and currently there is no recommendation to avoid blood donation at this time. We need as many people who can donate blood to do so, so that we don't run into a situation where we have a blood shortage for people who need it. Okay, let's see. I'm getting there. I'm getting to the end of my list and maybe to the questions. So we have talked before about our WIC services, women, infants, and children. We know that this is a vital and critical service that the Mobile County Health Department needs to continue providing, and we are doing our best to make that happen. Unfortunately, we just do not have the staff to keep all of our WIC locations open, so we have tried to consolidate those services at our New Bern location. We have been asking when or if the federal guidance will be changed during this emergency time to allow us to refill cards and provide services without having you come into the health department at New Bern. But right now they're not able to, or it hasn't risen to their level of importance. But we will continue making that request so that we can help you without needing you to come in. But again, we're sort of waiting on some federal guidance on that. So if you have questions for WIC, again, you can call 690-8829. Again, that's 251-690-8829. And I know it's tough for moms out there who, have young babies and they're having to come in to get their benefits. We got some information from one of our patients. Her name is Jo, and she was not happy that she had to come out and get her benefits, but we're doing what we think is right now to at least make the benefits available at a site that we don't have any ill patients at, to try to protect babies and moms. But again, right now we're just waiting to see if those federal guidelines will be relaxed so that we can make it easier for you to get those services. So thank you, Jo, and please continue to be patient with us if you can. Okay, are we ready for questions? Yes? Okay. So I have some that were submitted online and a couple that were submitted from the media, so I'll just try to go back and forth. So Steve Alexander from WALA asked, I know we'll want to get an update on test kits and any positives at that point. Maybe if you have any figures on how many tested negative too. Yeah, so I've already answered that question, yay. So I'll skip to his second question, which was talking about the issue of false negative tests. What happens is you need to be exhibiting symptoms of viral infection before that virus can be detected in your nasopharyngeal area or your oropharyngeal area. So these are the tissues way back in your head. So if you are tested too early before you are showing symptoms, there may not be enough viral particles on that swab to provide an accurate test. That's why we don't test people who aren't sick, because we don't want to pull a sample too early, it tests negative, and then give you a false sense of negative in case the test was done too early and you end up, not shedding virus later. So that's why we don't want to pull the specimen and run the test too soon, because there won't be enough virus on that swab in order for the laboratory to detect it. And then the next day, if you've got more ill, then you're spreading it to people. So we just don't want to have that false sense of negative test. Okay. The question here about, are we going to quarantine or stay at home or shelter in place like Florida and Mississippi are proposing, that like the Louisiana order, or Louisiana just passed? There are conversations ongoing every day at the state level about this. There are no pending orders that I know of that we're going to say everybody stay at home for 2 weeks. But I think you just need to, if everyone complied with the measures that we are recommending, then we may never have to say shut down for 2 weeks. But, we have to rely on the adherence, the voluntary adherence or compliance with those orders. We can't enforce it on everyone. So when it gets to where we're not able to rely on voluntary compliance, then we may get to that phase where we have to order it and then just shut down the borders. And ask everyone to stay at home. You should be prepared to stay at home for 2 to 4 weeks if requested. So please prepare for that. But I don't believe that that's on the horizon for Mobile County just yet. But as I've always said, check again with me tomorrow because it could change by 5 o'clock. Okay, let's see, from Jason at the Lanyap. Do you know how many ventilators, respirators, and hospital beds are at medical workers' disposal for treating severe COVID-19? The answer to that is yes. We have a pretty good idea of what is out there in the community. That is protected information. So hospitals, very early in this outbreak, our emergency management partners activated this system called AIMS. And that system requires that hospital input the number of beds and services that they have available on a daily basis. And so we can look at that application, that AIMS application, and know with pretty good certainty, how full the emergency departments are, how many isolation rooms are occupied, that sort of thing. Ventilators is something that we sometimes have to ask special for, but we do have pretty good information. I just can't give that to you publicly. Let's see. So let me switch back over here. How long can the virus last on paper, like incoming mail? So the virus can last anywhere from 3 hours to 3 days on surfaces. I think on paper, I've not seen the stats on mail, but I have heard on cardboard, it really cannot last that long on cardboard, maybe a day. But surfaces like plastic and steel, laminate, it could probably last a couple of days. So that one's that. Let's see, let's go to Tyler. Also, this is not right. Is Steve? Oh yeah, Steve and Tyler both submitted questions. Okay. Let's see. I said on Friday that I expect the case count to be higher by Monday from the Friday briefing to now. Only one can't say it. Yeah, so the question is, we had one case last week, and and then we had just one case over that we learned about on Friday. So we're now just at 2 cases. So, what's the reason for that? Is it that we don't have transmission, or that it's a lack of testing? I think it's more likely that we just don't have a good handle yet on, more widespread testing for the Mobile residents. But I believe since you're going to start seeing that open up a little bit, it would be expected that we'll be able to detect more cases in the community, and that number will go up. Let's see. Okay, somebody really wants to know what HIPAA is. So here's a question that says, can you remind us what is HIPAA, HIPAA, and why I can't tell you specific information about cases? So HIPAA is the Health Insurance Portability and Affordability Act, or something like that. And basically it says it's really the privacy rule that went into effect many years ago, that said that you can't share protected health information with people who have a reportable disease that could identify them. So I can't tell people. It's like me not giving people their credit card number, right? That's their protected information. I can't give it out because it would violate this law of protecting patient privacy, and we just can't do it. So what happens is I can say in general terms, maybe it was a county resident, or it was a child or an adult, or perhaps some information about their doing well at home, which both of our cases are, and maybe some about this person had international travel, but that's about all that I can say, because to do anything more, like to say what zip code they live in and what country they traveled from and how old they are and whether they're a male or a female, that might inadvertently reveal that person. Some really good Googler could maybe get on Facebook and run down and figure out who that person is, and we are not allowed by law to divulge that information to protect their privacy.
We've got an interesting one. Are patients housed in negative pressure rooms when they are hospitalized?
So the question is, are patients housed in negative pressure rooms when they're hospitalized? So the answer is it depends. If they are strongly suspected of having coronavirus, it is preferred that they are in a negative pressure room or an airborne infection isolation room, this very specialized AIIR term. So that is preferred when we have someone who has such, a condition that's highly transmissible, highly infectious, and again, a population that is totally immune, because we also want to protect our healthcare workers, and we need them to go to work. And in order to keep them working, we need to protect them from potential exposure. And in the hospital setting, there is a much higher level of personal protective equipment when healthcare providers are performing certain medical procedures on a person who's suspected of having COVID-19. Oh, okay. If my boss has a question, then she gets it. Let's see. Please make sure address comment about. Okay, I do not know about this. I guess there's a rumor that there has been a child that's died with COVID-19. I might be spreading the rumor right now, who knows? But we have not received any information on a child in our community that has died with COVID-19. In fact, in the entire state of Alabama, there have been no reported deaths. Okay. All right. Let's see. I'm taking a look. Somebody asked specifically about, did Mobile County get personal protective equipment over the weekend? I think that it was a little bit delayed. It may have arrived today, but it definitely is here or close. So I think with that, I will end my remarks for today. We are going to try to keep this 2:30 update going for you as long as we have viewers. It may change somewhat. We're having to sort of adjust our staffing model, so it may not be me every day. Hopefully someone else will volunteer from our staff to come in and address you and provide information. But again, if you have questions, post them to our Facebook page. Share the Facebook Live if you can, so that your friends and family and co-workers, if you are connected with them on Facebook, can share it so that we can get the information out to our community. And thank you, and we'll talk to you tomorrow.